Good afternoon, everyone, and welcome to our CSG eCademy webcast on hiring, retention, and reentry. My name is Elizabeth Whitehouse, Director of Education and Workforce Policy of the Council of State Governments National Headquarters in Lexington, Kentucky. I'm going to go over just a little bit of the webinar housekeeping that everyone will be in listen-only mode. You can type in questions in the GoToMeeting box on your screen at any time. We will get to as many questions as we have time for at the end of the presentation. And the webinar audio and the slides will be posted on the CSG Knowledge Center. And as an attendee, you will receive an email with the link for the audio and the slides after the presentation. I'm excited to introduce our first speaker, William Frank, who served as the co-chair of the Hiring, Retention, and Reentry Subcommittee of the National Task Force on Workforce Development for People with Disabilities. William Frank is currently the Deputy Secretary of the Maryland Department of Disabilities, and we're really excited to have you with us today.
Thank you very much, Elizabeth. It's great to be here. I have a few introductory remarks before we get started. Just to give you some background on the task force, like the Council of State Governments, or CSG, in partnership with the National Conference of State Legislatures, or NCSL, convened the National Task Force on Workforce Development for People with Disabilities. As leading associations representing state policymakers, CSG and NCSL are uniquely poised to highlight the issue of disability employment at the state level. The National Task Force oversaw the work of 4 subcommittees, each focusing on a unique policy area impacting the employment of people with disabilities. These 4 subcommittees are career readiness and employability. Secondly, hiring, retention, and reentry, which we're going to be focusing on today. Third, entrepreneurship, employment supports. Entrepreneurship, tax and procurement incentives. And fourthly, technology, transportation, and other employment supports. Each subcommittee was composed of 10 to 12 state leaders and 4 to 6 non-voting external advisors representing the private sector, key stakeholders, and/or academia. The members and leadership of the National Task Force have accomplished much in a short amount of time. In addition to the success of the task force identifying policy options to help state leaders move the needle on disability employment policy, members of the task force and the subcommittees already have signaled policy movements in their states. We'll talk about that today as well. We explore in this work a diverse range of components that can influence the development of the workforce of people with disabilities. The report serves as a guide on each of the policy areas the task force explored, designed to assist states in improving the ways the public sector serves people with disabilities and provides state examples of innovative programs and policies. A key tenet of the framework is having people with disabilities at the table when policy decisions are made. We encourage you to read the full report for more explanation. Thanks very much.
Bill, thank you so much for your leadership of the subcommittee and your work on the task force, and for that synopsis of the task force work. And I know we're so excited about the content we're going to cover today. I know that, Bill, you and the other task force members really had several overarching themes on approaching disability employment policy as a state official, including individuals with disabilities experience poverty and economic insecurity in substantial numbers, that employment facilitates independence and empowerment and economic self-sufficiency, and that everyone benefits when individuals with disabilities are in the workforce. And we all know that the labor force gains workers with valuable skills, and that states experience increased economic success when people with disabilities are a part of the workforce and at the table. Next slide, please. When looking at the development of the policy framework, there were several guiding principles that the task force identified for their work. One being that disability is a natural part of the human experience and that it in no way diminishes one's right to fully participate in all aspects of community life. As such, state disability policy should be consistent with and support 4 goals that the task force identified. that equal opportunity, including treating people with disabilities as individuals, that states should make assessments based on facts, objective evidence, and science, and provide effective and meaningful experiences in the most integrated setting possible. And that full participation in society, including engagement of people with disabilities in relevant decision-making at the individual and system level, including self-determination, self-advocacy, and informed choice. And also that economic self-sufficiency, including employment-related services and supports, financial literacy, and entrepreneurship and work incentives, are key to developing this framework. Lastly, of the 4 goals, that independent living, including skills development and long-term services and support, should be key policy goals. Looking at the other overarching themes, that disability can develop at any point during an individual's lifetime and have varying impacts. As such, state agencies should ensure service delivery is relevant at all ages, is inclusive of all types of disabilities, and maximizes the strengths and abilities of the individual. States should also provide a centralized systems navigation process so that people with disabilities and their families have a place to ask questions and get answers about rights, responsibilities, services, and supports. Successful disability policy embraces the nothing about us without us principle. Individuals with disabilities, alongside families, advocates, and champions from agencies, education, business, and communities, should be engaged throughout the policymaking process at all levels. This includes increasing the actual participation of people with disabilities at the highest levels of state government. People with disabilities are underutilized in our workforce and frequently experience social and economic disadvantage. There is a strong rationale for including people with disabilities in public policy efforts targeting other underrepresented groups like veterans, women, and minorities. Lastly, people with disabilities have valuable and unique contributions to make. State disability employment initiatives have the best chance at success when employers are motivated to hire people with disabilities, not because they have to or because it's the right thing to do, but because they recognize that disability inclusion helps boost the bottom line through increased innovation, creativity, and productivity. Next slide, please. Looking at the work of the Hiring, Retention, and Reentry Subcommittee, they focused on identifying how state government policies, programs, funding, and initiatives can increase the number and diversity of employees with disabilities in the public and private sector workforce through examining state government as a model employer, private sector employer engagement, interagency coordination and collaboration, and lastly, stay at work, return to work efforts. To talk about some of the work being done in this policy area and some of the research that the task force delved into, we have 2 guest speakers with us today that also served as advisors to the Hiring, Retention, and Reentry Subcommittee. We have Bobby Silverstein with us today. Bobby is a nationally recognized attorney with more than 40 years of public policy and advocacy experience and is currently a principal with the Powers Law Firm. Our next speaker, who will be in tandem with Bobby, is Michael Murray. Michael is the Chief Operating Officer of the American Association of People with Disabilities. Michael and Bobby, we're so excited to have you with us here today.
Thank you, Elizabeth. This is Bobby Silverstein and Michael, and we will be doing a tag team here to try to address the 4 topic areas that Elizabeth addressed: the state government as model employer, private sector employer engagement, interagency coordination and collaboration, and stay at work, return to work efforts. Could you go to the next slide, please? Before I jump in terms of state as a model employer, as Elizabeth said, we were acted as a resource to the various task forces. And we, based on the discussions at the different meetings we had, we identified actual hundreds and hundreds of specific examples of state policy that would address each of these topic areas that we're about to talk about. But before I get into state as a model employer, Michael, would you like to share some of what you did both in your previous life at the Office of Personnel Management in terms of the federal government as a model employer and some of the lessons that you learned? And then I'll jump in and move right into what some of the states are doing in terms of serving as model employers.
Oh, absolutely, and as always, Bobby, it is incredible to be hanging out with you, and Bobby is one of my mentors and someone that I look up to, and you guys are lucky to have him, and all the folks at CSG and NCSL, you guys have done an incredible job, and it's been an honor to be a part of the work that's been done, and thank you, Frank, for your leadership. I think as we start to dive into this, Bobby and I are going to go back and forth quite a bit. I previously was overseeing the federal government's hiring of people with disabilities in the federal government. So I worked with 56 different agencies throughout the country to help them recruit, retain, and honor federal employees with disabilities. We had a goal set by the President of hiring 100,000 people with disabilities over 5 years, and I'm happy to report that we had incredible success with that initiative and did meet that goal. In fact, we exceeded the goal of increasing the number of people with disabilities in federal service. And it's one of the accomplishments that the disability community and many people throughout the country look to this administration and say this was an accomplishment worth bragging about because you made a real difference and you also helped to influence other sectors. So with that being said, let's jump straight into some of the example policies that we've seen throughout the country, not only in the federal government, but also on the state level. Some we replicated, some we learned from you guys, some we learned from the private sector, some from the federal sector, and we'll jump into these various different examples. Bobby, should we go to the next slide and you start first?
I'm sorry, if you could go to the next slide then. So let's, again, I'm going to share some of what some of the states have done, and Michael's going to chime in appropriately in terms of his experience as well. What we noticed around the country in terms of state policies, states adopted three basic approaches. Some adopted only executive orders issued by the governor, like Kansas, New Mexico, and Vermont, to pursue the state as a model employer initiatives. Some passed legislation, like Arizona and Colorado, Connecticut, Illinois, Montana, Oklahoma, Utah, and a number of states actually did both. They had legislation and also issued executive orders like California, Maine, Minnesota, New York, and Washington. Now, we have one situation which is unique in the country at this point in time, and it happens to be that the deputy, Bill Frank, is from the state where there is a cabinet level position to act as a champion for people with disability, and that's the Maryland Department of Disabilities. And that is unique at this point in time in the country, where they actually sit at the cabinet level. And I don't know, Bill, if you want to chime in, if we can unmute you. If not, I'll just continue.
Sure. Yeah, thanks for the plug. Yeah, we back in 2004, former Governor Bob Ehrlich was instrumental in proposing legislation which elevated the Office of Disabilities in Maryland to the Department of Disabilities in the state. And as you mentioned, Bobby, it's a full cabinet level department, and we are still the only state in the country that has this cabinet level department representing people with disabilities at the highest level of state government. So we invite other states around the country to replicate what we've done. Jump in, the water's warm, and it's worked out really well here in Maryland. So we encourage others to follow suit. We're very proud of being the leader in this area.
Right, thanks. In the disability community, we have this concept of universal design, which is a notion that if you take into consideration the needs and desires and priorities of people with disabilities at the initial design stages, not only in physical plants and websites, but also all kinds of programs. If they're at the ground level, you can have a better chance of meeting the needs of the variation of folks with functional needs, and having somebody at the cabinet level to be able to have that input at the initial design stages makes all the difference in the world. Other states have not done cabinet levels, but have actually created task forces or committees, or in some cases interagency working groups to carry out the same approaches. Some of the states include Alaska, California, Massachusetts, New Mexico, Pennsylvania, South Dakota, Utah, and Washington. And many of these states have actually developed long-range strategic plans for increasing the employment of people with disabilities at the state level, including reporting to leadership on a regular basis. Now, Michael, you want to share a little bit about the executive order and how that worked?
Absolutely. And I think one of the things that Bobby just pointed out is a journey that we're all taking together, both on the state level and on the federal level. So if we look on the federal level, it started with an executive order from the President, Executive Order 13548 on increasing federal employment of individuals with disabilities. But now it's gone on that they are redoing regulations under existing legislation under the Rehabilitation Act of 1973, specifically Section 501, and they've proposed new regulations that adopt a lot of these practices so that it, moving forward, will become something that has legislation and regulation behind it. And so I think those infrastructures are, again, so super important. And again, we see this on the state level. Sometimes we see small groups of folks that are responsible for implementing these kinds of initiatives. Other times we see that very specific high-level agency heads are responsible for implementing these initiatives. But one thing that we know is true is if you don't have someone at a high level championing this and someone who is held accountable for ensuring success, that nothing's going to get done. And so that's one of the most important parts about having some kind of formal mechanisms or infrastructures to enact these policies, is you've got to have that structure in place, and you've got to have somebody who's being held accountable for those things in order for them to get done. And Bobby, I'm going to go ahead and jump in. I'll introduce the second one and then let you give examples. Another piece that we know is important on the policies is adopting hiring goals, surveys, and reporting mechanisms. And this is a quote directly from Bobby Silverstein: what gets counted gets done. I was presenting at the White House yesterday on a panel with Deputy Secretary of the Department of Labor and some other folks from the private sector and the federal government, and this repeatedly came up: what gets counted gets done. So what do you have in place to collect that kind of data? In the federal government, they use a reporting form called SF-256, but we've seen lots of other examples that Bobby, I'm sure, will point out and has done research on. Sometimes these surveys are anonymous. Sometimes they're specifically tied to an employee's Social Security number so that you can keep track of those. But the real point there is ensuring that on a regular basis you're asking how many people with disabilities do we have working for us, what is our goal moving forward, how many more people do we need to hire in order to really ensure equity within our state and within our hiring system, and then reporting that out. And I really encourage everybody on the phone and everybody who's working on these, don't be afraid to report. Don't tell folks how you're doing. If you're not doing well, then be honest about that. And if you are doing well, then brag about that. But put those numbers out there, because that's the only way that you can improve. Bobby, you want to jump in on examples of that?
Yeah. So when we met again 2 times for 2 days, and the number of state examples were described, and then we did some additional research to fill out that what the state experience actually was. So in terms of hiring goals and actually some preferences, we found, and this is again at the state level, state agencies, that Connecticut, Illinois, Iowa, Massachusetts, Minnesota, Oregon, Vermont, and the state of Washington all have adopted hiring goals policies for the state agencies. Minnesota, in an executive order, requires agencies to increase the hiring of employees with disabilities by 7% by August 2018, for example. A number of states have specifically focused on how to improve self-identification, because there are a number of people with disabilities who are still afraid to self-identify for fear of discrimination. But we found, like in Massachusetts, when they did a concerted effort with training and having some of the employee resource groups take the lead in saying this is a good idea and changing the culture of agencies in Massachusetts, they saw a very significant increase in the number of folks willing to self-identify. In terms of reporting mechanisms and surveys, there are a number of states ranging from Alaska, Illinois, Kansas, Maine, Massachusetts, Minnesota, state of Washington that have developed annual reporting mechanisms and specific surveys. And in Minnesota, for example, they analyze the goals, objectives, there are timetables, they develop internal audits and reporting systems. State of Washington has an annual report to the legislature as another example. So you're seeing that states are embracing these ideas of extending diversity and inclusion initiatives to not only women, minorities, and others, but to include people with disabilities as well. There were actually a number of states that actually included some preferences as well to hiring goals, much more akin to what the feds have done in some states with respect to veterans' preference. Michael, do you want to share with us a little bit about your FastTrack hiring authority experience in terms of hiring systems?
Sure, yeah, and before we jump onto that, I just want to echo one point that Bobby made around self-identification. We've done, there's a great body of research that is out there around this. Some of it AAPD has been involved with as well. And what it shows us is that that people with disabilities will self-identify that they have a disability if you create an open and welcoming environment where they know that they can disclose in a confidential manner. There are positive repercussions for disclosure. There are no negative repercussions for disclosure, and that there are folks at high levels inside of that employer who are disclosing that they have a disability. So those are the 4 kind of golden rules. So especially on that issue of confidentiality, and high-level disclosure, so important, and just want to emphasize that, and just say that if your state is having trouble getting folks with disabilities to identify on these forms and surveys, that really says more about you as an employer than it does about people with disabilities, because all the research shows us that they will disclose if you create that open and welcoming environment. So we encourage everybody to do that. Now, looking at hiring systems and fast-track hiring, this is the concept that, and I'm sure a lot of folks who are on the webinar with us and who are going to be listening to us later know that sometimes in government it can take a long time to bring somebody on board. And a lot of states have a way by which they can pull people on a little bit faster for specific reasons. And in the federal government, there is a hiring authority called Schedule A for people with disabilities. The regulation is 5 CFR 213.3102U, 5 CFR 213.3102U. But essentially, it allows for the federal government to bring people with specific disabilities in faster than they would be able to otherwise without having to go through that competitive process. And it also allows you to really target and say, we need to increase people with disabilities as an employer, and so we can now specify this is what we're looking for. And we do see some really good success with that in the federal government and other places.
Okay, so let me give some specific examples of what some of the states are doing. For example, in terms of special appointment lists for non-competitive appointment, let's look at Delaware, which has job applicants can take advantage of what's called the selective placement program. And once eligibility is established, individuals work with program staff to identify suitable positions, and then they apply. Maryland has something called the Special Options Eligible List FastTrack program, which provides the opportunity to engage in training programs or internships. And I'm wondering, Bill, would you like to add anything about that program, or should we continue on?
You keep going, guys. You're doing a great job.
Okay. Some other states, in terms of hiring systems, have adopted waivers or modified civil service exams. Some offer on-site exam accommodations, and those states include California, Illinois, New York, Oklahoma, and Utah. As I said previously, there are a few states, not very many, who actually have hiring preferences for people with disabilities, including Arizona, Kansas, and Maryland has a preference. Some states are using trial work periods, paid internships, assigning credit for work. Others, and again, Vermont is unique in having a mandatory interview option. If folks meet the qualification standard, folks with disabilities meet the qualification standard, they need to be interviewed. That's a relatively unique option that has been adopted by the states. And a number of states have, you might be asking the question for who can help with special appointment lists or hiring, figuring out trial work periods and internships and credit and interviews and understand how the process works. Well, in some states, there's a formal certification process for who is a person with a disability who qualifies for some of these fast-track hiring authorities. And oftentimes they use the state vocational rehabilitation program, and that includes Alaska, California, Illinois, Maine, and Oklahoma as states that do that. Another strategy used by states is to adopt a centralized accommodation fund and to have mentorship programs and internship programs. Massachusetts and Minnesota, for example, have explicitly included this centralized accommodation fund. And why? What is the purpose of this? It is basically to say that managers can hire people based on their qualifications and not worry that a provision of an accommodation will impact their direct budget. If there's a centralized fund, they can just worry about who they're hiring, not whether it will result in any extra cost. And some use a centralized expertise because some of these issues about accommodations and modifications of policies are best implemented when there are folks with expertise to provide the advice. And then training of state personnel staff is also a critical strategy that many states have adopted. Michael, did you want to share anything before we move on to the next topic area?
Very quickly on the FastTrack hiring systems, I just want to make a very quick point that this is not to reduce the quality of folks that you're going to bring in to be state employees. The goal is to remove red tape, to remove some of those barriers that prevent you from getting folks in quickly and getting them up to speed and really changing your system, but never to reduce those standards. So let's make sure that we never view it that way. On the centralized accommodation fund in the federal government, we do have some good examples of that, both on a government-wide level. At the Department of Defense has the Computer Electronic Accommodations Program, but also a lot of smaller agencies have those centralized funds. And as Bobby mentioned, you see that in a number of states. And again, the goal here is to ensure that the hiring decision is based not on the cost of accommodations, but based on the talents of the people that you want to bring in. And it really does reduce that opportunity for someone to have a conscious or unconscious bias towards someone that they believe may have an accommodation that will affect their bottom line and their budget. Next slide.
Yeah, let's move on now to the state build capacity of the private sector. We have about 15 or so minutes before we open it up to questions. Michael, did you want to jump in?
Absolutely. So, you know, when we look at the at what states can do to build private sector capacity, and this was kind of mentioned at the beginning by Elizabeth, but it's something that we came back to multiple times as we worked in this work group, but it's the concept that employers hire people with disabilities for essentially 3 reasons. The first reason is because they have to. There's some kind of law, there's some kind of executive order, there's some kind of requirement. The second reason is because it's the right thing to do, because they've got some kind of stake in the game. Maybe they have a family member. But again, when you do it for these reasons, sometimes you end up with kind of fluff, and you don't really end up with a really solid, long-lasting, implementable program. If you're doing it just because the law says that you've got to do it, and it's compliance-based, a lot of times it will only last for a short period of time while someone is looking, because compliance by nature is temporary. But the third and best reason that we see employers hire people with disabilities is because it leads to innovation, creativity, new ideas, new perspectives. And so as a state government, you can really build your engagement with the private sector utilizing these 3 concepts. You need to have some rules and things like that in place, and some laws that at least set a baseline and a foundation from which to build your house. But you can't just leave it at that foundation. You've got to build onto it. You've got to find people with heart and passion about it who are doing it because they believe in it. But you also really have to make the business case for why hiring people with disabilities makes sense. And you can do that through providing that technical assistance, through providing financial support and incentives, and we'll give some examples of those as we move forward. Next slide. Or Bobby, did you have anything that you wanted to mention on that opening slide?
No. Do you want me to jump into some of the state examples?
Or I'll jump in very quick and just say, so, you know, providing that technical assistance is something that is so important and that we see a lot of folks doing. And again, this is not only technical assistance on the laws that exist, not only bringing folks with disabilities and getting people invested on an emotional level, but also just showing that people with disabilities do increase the bottom line. And so, yeah, and go ahead and jump in on some examples, Bobby.
So let me give you some examples. Florida, for example, has a single point of contact to assist employers in navigating state and federal disability support systems. South Dakota, as another example, has adopted what they call the Ability for Hire campaign. It's an initiative of the South Dakota Department of Human Services and provides links to employers to critical resources that they can use. In addition, it should be noted that virtually every state voc rehab agency now has a specific individual or team that is whose mission is to work with employers in their state, and it's called the National Employment Team, or NET. And virtually every state now has VR employees whose commitment is to help private sector employers in terms of hiring of people with disabilities. So the idea of a dedicated staff, a single point of contact, and expertise working with employers and people with disabilities is key.
Absolutely. And then and establishing these databases of people with disabilities. And again, this goes to making it easy, and this is part of the business case that you as state government can set up systems and pipelines of talent, if you will, that will allow employers, especially in the private sector, to find folks who are qualified quickly and easily. We saw this work well in the federal government with the OPM shared list run by Vendor Consulting, but there are state examples too. Bobby?
Yeah, I mean, we have what's called this Talent Acquisition Portal, or TAP, which is done by the Council of State Administrators, VR, and a number of states have adopted. Utah has the Persons with Disabilities Net Job Opening Program. Florida, for example, has the Abilities Work Web Portal, which does the same thing. So we are finding that some states are adopting this notion of a database of qualified people with disabilities looking for work.
Absolutely. Next point, when we look at affirmative action programming and goals for government contractors, this goes to that, that concept that I talked about at the beginning, building that foundation of laws and requirements. We do need those things. It can't be the only reason that private sector hires people with disabilities, but it can really work well as a foundation. We see on the federal level, there's Section 503 of the Rehabilitation Act of 1973, and it's now set up a 7% utilization goal for people with disabilities to be hired in at federal contractors. And again, this is specifically for federal contractors. And we've seen great success with that. A lot of federal contractors are getting on board, are very excited about it. And the Office of Federal Contract Compliance Programs at the Department of Labor has been doing a great job of interacting with those employers in a very positive way, not in a way of forcing folks or pushing it on them, but in a way of giving them the resources that they need to meet that 7% utilization goal. But we've also seen a lot of state governments do the same thing and replicate this. And have state contractors have some kind of goal for hiring people with disabilities. Bobby?
Yeah, and those states, and in each of the states that I'm about to mention, there is a specific affirmative action requirement for state government contractors for people with respect to women, minorities, and what they've done is they've added disability to that list. And the states include Connecticut, Kentucky, Maine, Minnesota, New Jersey, Rhode Island, and Wisconsin. In addition, there are other examples of what states are doing to facilitate hiring at the private sector. And we are seeing, for example, a number of states that have adopted tax incentives for hiring people with disabilities, including Maryland, New York, Tennessee, Iowa, and Louisiana. And we're also seeing in some states that you're getting tax credits for providing employment supports and services for people with disabilities that supplement the federal tax credits for accessibility, including Maryland has a disability employment tax credit, Kansas has legislation, as well as Iowa assistive device tax credit. Next slide, please. Another major finding of the task force that worked on hiring, retention, and reentry, I call it task force, or it was actually a subcommittee. There was a major focus on interagency coordination and collaboration. A lot of discussion about the concern about silos and how to break down those silos and how to navigate various state agencies to provide the services and supports necessary to help enhance employment for people with disabilities. And so what we see is extensive efforts. There's something called Employment First that many states have adopted legislation to enhance competitive integrated employment for those with the most significant disabilities. And there is a website that specifically has a map of what all the various states are doing, and it's under what's called the LEAD project, LEAD.org. And you find that a key thrust of that is to have VR agencies, for example, working with Medicaid, Medicare, mental health agencies focusing on those with intellectual developmental disabilities. There's also requirements in the recently enacted Workforce Innovation Opportunity Act, which funds American job centers with requirements for collaboration and coordination, particularly with the VR agency, the Medicaid agency, the mental health agency, and the agency for folks with intellectual disabilities. I actually just finished working with the state Council of State Vocational Rehabilitation Commissions, and it's called CSAVR, and also with the lead agency to develop model interagency memorandum of understanding, again, between VR, Medicaid, mental health, and intellectual disabilities. And that's available on the CSAVR website and as well as the LEAD website. And part of what they talk about is the blending and braiding of funding. And blending of funding means you take funds from different sources and pool them. And braiding is you keep the funding source separate for audit purpose, but you braid them and you figure out how to coordinate services for the individuals. And there are a number of states that are doing Employment First, and some models are California, Florida, Iowa, and Ohio, to name a few. Let's go to the next slide. and this is stay at work and return to work. This is a major effort in at federal level, but also at state levels, and particularly at state levels, where you're trying to, if somebody gets injured or becomes ill on the job, how do you keep them working? Because once they disengage, it is very difficult. And then also return to work efforts where people are still maybe had a significant accident, and how do you get them back to work as soon as possible? And we see that states are developing policies to facilitate both staying at work and returning to work. And let me share some examples. Next slide, please. So if we look, for example, in terms of what is being adopted at the public sector in terms of stay at work, return to work by state agencies. Delaware and Vermont, for example, have specific programs for state employees. And in fact, Delaware has specific coordinators that work with disability insurance carriers, physicians, and employers to ensure quick reentry for those who have left the state workforce, as well as staying at work. Vermont includes disability accommodation services as part of its statewide employee assistance program. And Arkansas, for example, the VR agencies work very closely to help expand the availability of retention services for state employees. In addition, there are some states that have enacted legislation or adopted policies to dealing with the private sector. Alabama, Arkansas, Georgia, and South Carolina VR agencies have expanded retention services. In addition, we have in some states a short-term disability insurance that has been enacted by the state legislature, and in those states, for example, exclusive state workers' compensation funds that have implemented promising job retention initiatives for workers with work-related conditions. And that includes, for example, the state of Washington, North Dakota, and Ohio. Washington has a Center for Occupational Health and Education program with trained health service coordinators who work directly with medical providers, employers dealing with injured workers. A very important program. There are also some programs at the federal and state level to help people with disabilities and employers navigate the complexity of the SSI, the SSDI, Medicaid, Medicare programs, as well as state benefits. Some states actually have supplemented the federal program called the Work Incentives Planning and Assistance Program, or WIPA. Arizona, Ohio, Oregon, Texas, Virginia, and Wisconsin provide state funding for what we call benefits counseling. So that's a quick summary of some of the major examples of state policies with a background of what the feds are doing in terms of hiring, retention, and reentry. Elizabeth?
Bobby and Michael, thank you so much for providing your expertise and all of the time that all three of you donated to this national task force and weekends away and all the hard work you put into this. I'm so excited on December 8th that we're going to have a Disability Employment Policy Academy at the CSG National Conference to launch the Work Matters report of the task force, with all of the great policy options that were identified in this subcommittee and the other three, this is the last of our four-part webinar series, and I know that we've received a few questions for our three guest speakers today. Michael, I think one of the first ones was directed at you. We had an attendee ask, what are the ways states can ensure that private sector employers can best support disability employment policy and reentry?
And the question was, what are, can you say the question again?
Yes, sir, Michael. What are ways that states can support private sector employers? What can states do to support private sector employers regarding disability employment?
Yeah, and I think that all of the things that we just went over are really vital. And again, I think thinking about it from the perspective of those three foundations of what are some laws and rules that you can put in place that can give a baseline for employers to know what they're working with, and be consistent on those, and be straightforward, honest, open, and helpful, but then also giving folks a really positive reason to do it and telling those stories and putting some heart behind it. But but the most important one is that third piece, which is really giving folks the business case for why this is going to support and help their business. And we know that it does. There are so many examples of where businesses have engaged with people with disabilities and engaged the disability community, and it's been a win-win for them as a business and for the disability community.
Now, this is Bobby, if I could chime in for one quick second. Michael said, he quoted me as saying what gets counted gets done. Actually, that's not my quote at all. I had the privilege of facilitating a meeting of 40 of the major companies around the country, and that's what they told me, and that's what I reported in a document called Roadmaps dealing with employment of people with disabilities. So that's what they said over and over again. What gets counted gets done. That's their experience in the private sector. And it's, again, not surprising that some states, particularly specifically at the state level for state agencies, as well as state contractors, have adopted the notion of having goals, timetables, and having reporting, and having assignment of responsible leadership.
Absolutely. And lastly, I would say, really, as a state, being a model and living by what you're expecting the private sector to do is so important, because if you're asking the private sector to hire people with disabilities, but yet you yourself as state government and as an employer aren't living it, it doesn't mean one has to come before the other, but you got to be trying to do both at the same time.
No, thank you both so much. Sorry?
Oh, no, go ahead. Go ahead. I was going to say, any other questions?
No, thank you, Michael. And I think that if anybody does have any other questions, we've got a couple more that have come in. But if you want to ask a question of our guest speakers, we have the GoToWebinar has a question comment box that you can put your questions in that we can then call out. Another one came in, Bobby, for you. If you could tell us an example of one of the hiring, retention, or reentry policies that you see in the states as being the most innovative, or a great practice for others to look at.
In terms of, given that we've looked at and identified 300-400 different best practices, you want me to pick the one I think is the best, the most innovative? That's difficult. I think rather than trying to identify a substantive one, I think I'm going to go back to Maryland and the idea of having a cabinet-level position for disability. I just can't think of that. That's a process issue. It's an infrastructure issue, but it's probably the most important of all, the most innovative, and the one that will probably have the greatest outcome results for people with disabilities. When you're at the table, when things are being designed, and if you can get the input from people with disabilities, from a disability perspective, you have a better chance of serving a greater number of folks with functional needs. So it's probably Maryland's cabinet position.
Thank you very much.
And Bill, listening to that, what is something that you see as a successful strategy that you've used in your state in Maryland, or that you've really noticed is one of the most effective in encouraging the hiring of people with disabilities?
I think just to piggyback off of Bobby's comment, thank you very much for those positive remarks. One of the things we also do here at the cabinet level in Maryland is we have what we call the IADB, the Interagency Disabilities Board, and this is composed of cabinet level secretaries of different departments who get together several times a year and hash out issues that impact disabilities, whether it's a transportation issue, or maybe it's a health issue where the health department gets involved, or it's a human resources issue where the Department of Human Resources gets involved as well. These are things that that the government does that impact people with disabilities every day, and for us to have an interagency approach where we're kind of collaborating and comparing notes and making sure that people with disabilities don't fall through the cracks, I think that's really, really important, and that's kind of an add-on to having a quote-unquote seat at the table, as was mentioned before. But as far as some of the innovative things that we're doing here in Maryland, I would say that the tax credit is also a very positive thing that we've seen a lot of good movement toward. And also, we just passed a bill this past spring in Maryland, which adds 5 points to a state application. So if someone's applying for a state job and they have a disability, they get an extra 5 points toward their, hopefully, their employment. Keeping in mind that if the person's not qualified for the position in the first place, these 5 points won't make a difference. But once we establish that the person has the qualifications to do the job, we award that person 5 extra points, and that's been very, very successful in gaining employment for people with disabilities who may not have a chance to have a job otherwise. So we've seen that as a real positive.
Bill, thank you for those examples that other states can really look to and are things that they can take action on if they choose to. And I want to thank you all, William Frank, Bobby Silverstein, and Michael Murray, for sharing this valuable information with us today. And again, I'll mention that we've got this great Policy Academy on workforce development for people with disabilities on December 8th if you're available to join us at the CSG National Conference in Colonial Williamsburg, coming right up. And thanks again, everyone, for attending our CSG eCademy webcast. You'll receive an email in the next few days letting you know the slides and audio from the webinar are posted on CSG's Knowledge Center. We will also post additional information and from our speakers and resources as we lead up to the launch of our Work Matters report of the National Task Force. So please feel free to share this information and the link to this webinar with your colleagues. And thank you all so much, and especially thank you to our speakers today.
Thank you.
Thank you very much.
Thank you, everyone.